Judiciary Subcommittee on the Constitution is holding its second field hearing of the year. This field hearing will examine the patchwork of abortion restrictions across the United States, a patchwork that has caused chaos and confusion across the country for the patients who seek care and for the doctors who provide it. As the availability, accessibility, and legality of abortion varies widely from state to state and can suddenly change in the blink of an eye, as we recently saw here in Arizona, women are left bearing the brunt of the fallout. A fallout that began with the brazen actions of a disillusioned Supreme Court majority 2 years ago. Yesterday marked the second anniversary of the Supreme Court's disastrous decision in Dobbs versus Jackson Women's Health Organization, overturning nearly 50 years of precedent, protecting patients' constitutional right to an abortion. The Dobbs decision unleashed a terrifying new reality for women and for families. In the first year following the Dobbs decision, over 25 million women found themselves living in states where their future was no longer their own. State legislatures have pursued political agendas to strip women of their freedoms and undermine the patient-physician relationship. The decision to start a family and build a family is one that should remain between a woman and her doctor, not politicians nor judges. And yet, state courts and state legislatures have stolen away this right for nearly 1/3 of reproductive age women in this country. As a result, women are being denied essential health care and forced to carry pregnancies to term. Doctors fear prosecution simply for providing the care they've been trained and taken an oath to deliver. The Dobbs decision upended 50 years of precedent and decades of progress on reproductive freedom. As abortion care is no longer constitutionally protected in the United States, access to safe and effective reproductive health services now falls in the hands of individual state legislators, creating an ever-changing landscape of chaos and confusion. Today, 14 states in our country ban abortion with limited exceptions, and a total of 21 states ban abortion at an earlier stage of pregnancy than was allowed before Dobbs. That means that while some states have moved to protect abortion access, too many others have implemented restrictive bans. The end result? Women across our nation face a myriad of restrictions when seeking abortion care. They may be unsure if access to care they need is permissible in their state, or question whether they are too far along in pregnancy to receive the care that they need. These restrictions result in delays and denials of care that have devastating impacts on women's health, economic security, mental and general well-being. Some patients are even forced to drive hours away across state lines just to find the abortion care they so urgently need. Research tells us that an additional 8,000 to 16,000 people will travel to my home state of California to seek abortion care each year as a consequence of the Dobbs ruling. And research demonstrates that these restrictions are not felt equally. According to the data from the Centers for Disease Control and Prevention, nearly 60% of all Black and Native Indigenous women of reproductive age live in states that have banned or are likely to ban abortion. This is particularly troubling as Black women already face the highest rates of maternal mortality and morbidity in this country. And experts warn that abortion restrictions will only work to exacerbate the maternal health crisis. This afternoon, we'll hear from Arizona-based witnesses who will highlight their experience seeking and providing abortion care. We'll also hear from national policy experts on the fight for reproductive freedom in every state. In conclusion, I want to recognize the gravity of the moment in which we're holding this hearing. After 50 years of precedent, the Dobbs decision and its aftermath have left our youngest Americans, like my 9-year-old daughter, with fewer rights than those who came before them. Think about that. Our daughters, nieces, young relatives who are now growing up in a world with fewer freedoms than we had. Shameful. It's shameful that we are saddling these young leaders with fighting for the same battles that their grandparents fought and the battles that their parents thought they had won. The promise of our nation has always been that each generation would work and sacrifice to ensure that the next generation would do better. The Dobbs decision and this patchwork of state laws has broken that promise. Our witnesses today are going to help us understand the impact of those broken promises, and based in their experiences are going to share with us how Congress can restore those promises to future generations. Thank you all for being here, this field hearing in Phoenix, Arizona. I will introduce our witness panel. I will make sure to communicate how the hearing will carry forward, and we will proceed to hearing from our witnesses. On our first panel, I'd like to welcome Ms. Eloisa Lopez, a first-generation daughter of Mexican immigrants born and raised here in Phoenix. Ms. Lopez serves as the Executive Director for Pro-Choice Arizona and the Abortion Fund of Arizona, and has held various leadership roles within the organization since 2018. She first joined the organization in 2017 as an Abortion Fund helpline volunteer. Her work is focused on merging the narrative of maternal health care with abortion care and progressing pregnancy and family justice. Ms. Lopez's lived experiences have fortified her commitment to justice. Next, I want to welcome Dr. Misha Pengasa. Am I pronouncing that right? Says the person with Z's and P's in their name. A board-certified OBGYN and complex family planning subspecialist who is committed to providing comprehensive reproductive care to her patients. Born and raised in Yuma, Arizona, Dr. Pengasa completed her undergraduate studies at the University of Arizona and her medical degree at Weill Cornell Medical College. She completed an OBGYN internship at the Metropolitan Hospital in New York City and a residency training at the University of Pittsburgh. The diversity of practices she witnessed in reproductive care based on geographic and institutional abortion care restrictions prompted her to pursue fellowship training in complex family planning, a subspecialty centered around complex contraceptive and abortion care at the University of Utah. After the completion of her fellowship, Dr. Pengasa moved back to her home state of Arizona, where she remains committed to providing comprehensive, evidence-based, patient-centered, non-judgmental reproductive health care, particularly for vulnerable populations. Last on our witness panel, I'd like to welcome Ms. Minnie Timaraju. Ms. Timaraju is the president and CEO of Reproductive Freedom for All, an organization that mobilizes its members to protect access to abortion, birth control, paid parental leave, and protections from pregnancy discrimination. Ms. Timaraju is the first woman of color and immigrant to helm the organization. Prior to her work at Reproductive Freedom for All, Ms. Timaraju served as senior advisor to the director of the U.S. Office of Personnel Management in the Biden-Harris administration and as a director for several state and local organizations. Ms. Timaraju earned her Juris Doctorate from the University of Houston Law Center and earned her bachelor's degree from the University of California, Berkeley. Before we move forward, I'd like to outline for everyone the mechanics of today's hearing. After we swear in the panel of witnesses today, each of them will have 5 minutes to provide their opening statements. After their opening statements, we'll then move to the next portion of the hearing where I will have the opportunity to ask questions. I'd ask the audience to remain quiet during the hearing to preserve the congressional record. Shouting, verbal disruptions are strictly prohibited in the United States Senate committee hearings, and any members of the audience who violate these rules will be asked to depart. Issuing the oath, if our witnesses will stand and raise your right hand. Do you affirm that the testimony you are about to give before the committee will be the truth, the whole truth, and nothing but the truth, so help you God? Let the record reflect that the witnesses responded in the affirmative. Thank you all. Ms. Lopez, could you please proceed with your opening statement?
Yes, thank you so much for having me today, Senator Butler, and for holding this hearing in Arizona. I'm Eloisa Lopez, Executive Director of Pro-Choice Arizona and the Abortion Fund of Arizona, and I'm grateful for this opportunity to share my story and speak on abortion access. As a child and young adult, I never felt a strong desire to become a mother. One day, maybe that was due to my upbringing in an extremely conservative Christian religion that ingrained the idea in me at an early age that my sole purpose on earth was to have children. But I knew I wanted a career I could be proud of, and the role of parenthood just didn't feel like my calling. I had my first abortion when I unexpectedly fell pregnant in my mid-20s. There was no guilt and no shame, but going through that experience opened my mind to the idea of parenthood. And soon after, I chose to have my first child with the partner I had at the time. After birth, the physical demands on my body were intense, and I quickly fell into postpartum depression and anxiety. And I also realized I did not have a supportive partner in this parenthood journey. Unexpectedly, I found myself living in domestic abuse while still in postpartum recovery. I had given up work to be a stay-at-home parent, yet my partner continually reminded me that my labor as a stay-at-home mother had no value because I wasn't out in the workforce bringing home money. By the time I was pregnant again and moving forward with having a second child, my toddler and I were living in a very hostile and violent environment. I had a pivotal turning point in that pregnancy. I was finally able to name what I had been feeling for years. I did not want to be alive anymore and continue living like this. And during this pregnancy, I began volunteering with the Abortion Fund of Arizona as an outlet to escape my reality of domestic violence. After learning about their mission to support and advocate for pregnant people seeking abortion care, I threw myself into this volunteer work. My first role was returning phone calls to people, abortion seekers, requesting financial support to pay for abortion care that they could not afford. And I identified with these callers because of my own experience of abortion and needing financial support myself. I am now in my 6th year as the Executive Director of the Abortion Fund, and I'm proud to say that our organization has supported nearly 3,000 abortion seekers since 2017. We are a grassroots, community-based organization powered by our own communities, volunteers, and 4 staff members. And we are grateful to those who continue to invest in our work. Now, after the 2022 Dobbs decision, the availability and accessibility of abortion care and maternal health services vary from state to state, amplifying an even more disproportionate healthcare system for pregnant people. Reproductive health care and abortion access in the South have essentially been demolished, and we know that is fueled by white supremacy and racism. Communities of color, low-income people, non-binary and trans people, and those living in rural areas face the most barriers when accessing abortion care. And in Arizona, after Dobbs, we immediately experienced the revival of an 1864 abortion ban. The efforts to revive this antiquated ban confirmed to us all that the opposition will stop at nothing in their attempts to strip us of our freedoms and control our bodies, our gender identities, and our reproductive outcomes. Thankfully, our fund was prepared to handle the influx of callers we received due to the legal confusion and uncertainty of abortion laws in our states. Since June 2022, our fund has pledged over $569,000 to support 1,620 individuals to help them access abortion care wherever they need to go. I had my 4th abortion this past April, right before the Arizona Supreme Court had announced they would uphold the '64 ban. No shame about my decision and no guilt, but what I did feel was fear for all pregnant people who live under oppressive abortion bans and restrictions. Fear that one day I might have to risk criminalization in exchange for the autonomy of my body. I felt saddened at knowing so many people are criminalized for their pregnancy outcomes and that so many people have to travel hundreds of miles to access care. Abortion funds know firsthand that the limited legal right to abortion established in Roe v. Wade was never enough, and we need our communities and elected officials to understand that every pregnancy experience is unique and all abortion bans are counter to health and safety. Therefore, we need access to unrestricted abortion care. And this is the moment that demands elected officials listen to the decades of experience that abortion funds have and dream bigger with us so that we can ultimately build and achieve where all of us, whoever we are and wherever we live and however much money we make, we can have not only to survive, but to thrive. Thank you, Senator.
Thank you, Ms. Lopez. Dr. Pangasa.
Good afternoon, and thank you, Senator Butler, for holding this hearing. My name is Dr. Misha Pangasa. I use she, her pronouns, and I'm a board-certified, fellowship-trained OBGYN providing full-spectrum reproductive health care. I'm a fellow with Physicians for Reproductive Health, a proud physician who provides abortion care, and a proud Arizonan. It is an honor to care for my community here in Phoenix. I became a doctor because of my commitment to care for people without judgment throughout the course of their lives. For me, that commitment includes caring for people throughout the many different roads traveled to create the families they desire, whether that's optimizing their health, delivering their babies, or supporting them as they end a pregnancy. Whether I'm caring for someone who's ready to build or create a family, already parenting, grieving due to an unexpected pregnancy diagnosis, or who does not want to be pregnant, all of my patients have something in common. They are making thoughtful decisions about their health and well-being. Each of them deserves high-quality health care throughout their pregnancies, no matter who they are or where they live. My priority is always to provide high-quality health care to all my patients, no matter the direction their reproductive journeys take them. But geographic, legislative, and politically motivated barriers to abortion care have made delivering high-quality health care to patients in Arizona challenging. Abortion care is safe, life-saving, necessary, compassionate, and essential. And none of the arbitrary barriers or bans imposed by politicians make it any safer. The biggest threat to my patients' safety is the litany of medically unnecessary regulations that raise costs and delay procedures, ultimately putting my patients' health at risk. Unfortunately, the escalating abortion bans and restrictions in the states and the Supreme Court's decision in Dobbs, which overturned the constitutional right to abortion, has wreaked havoc on communities across the country. In Arizona, we have been subjected to a constantly shifting legal landscape and the ever-looming threat of a complete abortion ban. While I currently am still able to care for many people early in their pregnancies, people in Arizona are being forced to wait further into their pregnancies and to travel farther and farther away from their communities to get basic essential health care that I should be able to provide them here at home. They wonder whether tomorrow, next week, or next month they'll still have options if they're faced with a pregnancy complication. They wonder if I'll be able to care for them or if I'll have to send them to another state if they find themselves in a situation in which abortion is right for them. And this is assuming that they have the resources or the immigration status to travel. They wonder whether I'll even be allowed to counsel them through all of their options, or if I'll be threatened with a lawsuit or prison time for even bringing up the possibility of abortion, like providers in other states have been. I see and hear their fear about the future every day. And for those that I've already had to send away, the people who haven't been able to meet the arbitrary criteria for abortion care in Arizona, who I know don't have the means necessary to pay for travel, childcare, time off work, their faces still haunt me. We know that even before the Dobbs decision, thousands of people did not have access to abortion care, and we know the impact that that has on people's lives. Reputable, large-scale scientific studies have shown us that people who are denied an abortion are more likely to experience serious medical conditions in the end of their pregnancies. They're more likely to remain in relationships with violent partners. They're less likely to be able to lift themselves out of poverty and provide for the basic needs of their families and the children they already have. As more and more states continue to ban or severely restrict abortion, the ripple effects continue to compound and impact other types of essential health care. We've seen vague language being used, sometimes intentionally and sometimes unintentionally, to limit access to emergency contraception, IUDs, miscarriage care, and IVF. We also know that these restrictions to basic health care affect the health of our country more broadly, especially because of the harm on the provider workforce. So many places in this country already suffer from provider shortages, and those communities, often those already marginalized and experiencing some of the highest rates of morbidity and mortality, are those which more and more doctors are leaving or choosing not to return to because they know that providing evidence-based healthcare won't be possible. Despite all of these threats, I am unwavering in my commitment to support people in my home and in my community whatever way I can. It shouldn't have to be this way. People should be able to get care in their own communities in a manner that's best for them with the people they trust. Thank you for having me today, and I look forward to questions.
Thank you, Dr. Pengasa. Ms. Timaraju.
Thank you so much, Senator, and I want to thank my colleagues from Arizona who provided such incredibly moving and personal testimony. It's an honor to do this work as an advocate side by side with providers and the folks doing the life-saving work of raising the funds, getting patients from point A to point B. Arizona has been a very clear example of the stakes post-Dobbs. So thank you so much for the opportunity to provide this testimony to the Senate Judiciary Committee, Subcommittee on the Constitution, and for convening today's hearing. My name is Minnie Timaraju. I am the President and CEO of Reproductive Freedom for All, formerly known as NARAL Pro-Choice America. Our organization, including our chapter here in Arizona, where we have over 75,000 members, is dedicated to protecting and advancing reproductive freedom alongside our 4 million members nationwide, including access to abortion at the federal and state levels through education, organizing, and public policy. Every day, millions of people across our country are suffering because of anti-abortion extremist bans. 21 states have already eliminated or restricted access because of abortion bans, forcing, as you've heard, some people to travel hundreds of miles to other states to access an abortion and leading many blocked from care to live through horrific situations. Anti-abortion lawmakers are using the Supreme Court's decision in Dobbs as a green light to build upon restrictive abortion laws, further infringing on people's bodily autonomy, undermining their right to travel to access care, and criminalizing pregnant people and those who help them, including their doctors. And we're waiting on another decision any day now from this court that actually said they were done with the business of abortion. So this patchwork of legal abortion in our country means your freedom to build the life that you want is determined by where you live, how much money you have, and your ability to travel. Nowhere in the nation is a better demonstration of this patchwork and what we can do to fight back than here in Arizona. In Arizona, abortion is currently banned at 15 weeks with 40 additional restrictions on abortion. And in April, the Arizona Supreme Court ruled that an 1864 ban on abortion could be enforced, generating widespread fear and confusion across the state. Fortunately, due to the very hard work of Governor Hobbs, Attorney General Mays, and Democrats in the state legislature, that abortion ban was repealed and will not take effect. This means that Arizonans can still access abortion care and providers can still provide legal abortion care up to 15 weeks without being prosecuted. While we face a crisis, the good news is that the American people have shown that they will not tolerate these attacks. Since the Supreme Court overturned Roe, voters have gone to the polls 7 times to weigh in on abortion, and all 7 times they have cast their ballot to protect and expand reproductive freedom. And Arizonans are on their way to do so as well. The Arizona for Abortion Access campaign has already collected well over 500,000 signatures to set up a ballot initiative to establish a fundamental right to abortion in the Arizona Constitution. However, our work to protect our fundamental rights does not end there. Anti-abortion extremists know how deeply unpopular their agenda is with the American people, so they use the courts to push through extreme legal theories to decimate reproductive freedom and ban abortion care nationwide, just as we're seeing this term with the abortion cases before the court. Ongoing revelations about conservative justices' ethical scandals, as well as anti-abortion extremists' documented work to influence the court underscore the urgent need for investigations and court reform. 8 in 10 Americans agree the decision on abortion should be made by a pregnant person and their doctor, not the government. 2/3 of Americans support a nationwide law guaranteeing access to abortion. Congress must continue to prioritize reproductive freedom, and we must pass a federal right to abortion. We also, though, must ensure access to care, and you heard a lot about the barriers to access right here in Arizona, by eliminating the Hyde Amendment and expanding health care access, including reproductive health care for immigrants and their families. We must keep pushing for court reform to restore the legitimacy of our judiciary and uphold our fundamental freedoms. And I'll throw in, we need voting rights reform. Democracy and reproductive freedom are intertwined fundamentally. And I'm also proud to say that we announced a big national initiative with our colleagues across the country called Abortion Access Now, focused on passing a federal right to abortion and expanding access through Congress and hopefully a future Biden-Harris administration. So thank you for your leadership and work to ensure that all of us have the freedom to make our own decisions about our lives, our bodies, and futures.
Thank you, Ms. Timaraju. To move to questions, Dr. Pengasa, I would like to sort of direct my first series of questions towards you, just to establish the medical foundation about the subject in which we're speaking, the relationship to healthcare, and how this is a subject that doesn't just impact those wishing to have children or just determine whether or not they're going to, but all of us in the U.S. healthcare system writ large. I'd like to start with just picking up on a point that you made about safety and effectiveness. Each year, hundreds of thousands of women across the U.S. receive safe and effective abortion care. The American College of Obstetrics and Gynecologists state that abortion is an essential component of comprehensive evidence-based healthcare. Abortion access should be regarded as critical healthcare for women and families in our country. Dr. Pengasa, can you speak to the safety and effectiveness of abortion, just to bring us from a medical perspective to an understanding of how you would underscore the importance of abortion and the full range of reproductive health care?
Absolutely. Thank you for the question. One thing that you learn as an OBGYN is that pregnancy and health in general can be very complicated, nuanced, fluid. Healthcare matters. And so having abortion care as a component of that can be offered to people is absolutely essential. Abortion care is a safe option for many people. We know that having an abortion has about a 1 to 2% likelihood of having complications. It's about considered as safe as a colonoscopy or wisdom teeth removal. And we also always need to consider that in the light of the safety and risks of pregnancy. The United States has one of the highest rates of pregnancy-related morbidity and mortality, and having access to abortion care to be able to counsel patients about their full range of options in the context of their lives and their health is absolutely essential.
And to continue that, I understand that you are not a mental health professional, but in your experience in counseling women and families now in this sort of post-Dobbs world, can you speak to the mental health impact that you've seen your patients experience and how these two things can be related?
Absolutely. So I would actually start by saying, while I have lots of anecdotal experience with patients who have a tremendous amount of relief from their abortion and recognize that there is large-scale, reputable scientific studies that have been done on this that have shown that actually people who are denied abortions are more likely to struggle from mental health impacts on that. And the majority of patients who are able to have an abortion that they seek, even up to 5 years later, express an enormous amount of relief and reaffirm that it was the correct decision for them. And so in my own practice, the anecdotes that I see absolutely echo the evidence, which is that denying somebody the access to abortion, which they have thoughtfully made a decision about, has much more profound impacts negatively on their mental health than allowing them to have access to the full range of their options.
Last question directed to you just at this point. It was of note to me in your written testimony that was submitted to the committee, and I believe you referred to it in your testimony here, this question of the impact of these laws relative to the cost of healthcare for society generally. We have had a conversation in this country about the cost of healthcare for what feels like forever. And now, on top of an existing complex, complicated, expensive healthcare delivery system that is not patient-centered, we have now this new law or this decision by the Supreme Court and states passing subsequent sort of, as we are here to talk about, patchwork solutions for the court decision. Can you talk a little bit or elaborate a little bit to the degree that you can about the overall costs to the healthcare system broadly, that whether or not a person is seeking an abortion, this decision will have an impact on them?
Absolutely. So, from first of all, the individual level, the reality of this patchwork is that both patients and providers are constantly trying to navigate medically unnecessary regulations that often push patients further and further into their pregnancies. So from an individual level, that cost perspective in terms of healthcare utilization is definitely burdensome. From a larger perspective, being able to practice evidence-based healthcare is an incredibly important component of why people become physicians. People go into this to be able to deliver the best care for their patients. And when they are faced with the decisions about whether or not they can treat patients in the best way that they know how, or they're going to have to maneuver, again, medically unnecessary, administrative, bureaucratic, politically motivated barriers, it deters people from working in those places. And as I mentioned, there are so many communities in rural areas, in communities that are already marginalized by the healthcare system, where access to care has already been limited. And the reality is that as providers leave those areas because they're not able to provide evidence-based healthcare, the cost on those communities and the cost of having those patients have to travel for not just abortion care, but for other essential services only expands. There are states in this country where a quarter of all OBGYNs have left because of extreme restrictions, and more hospitals have had to close obstetric services altogether. And that doesn't just impact people who want abortions, that impacts people who have to go to the hospital. And so I think that that's something that we definitely need to consider for the country more broadly.
Thank you for that. Ms. Lopez, thank you for being here and for sharing your personal experience as well as your professional experience and journey related to the fund here in Arizona. Can you just talk a little bit about how abortion access and the ability to build your family on your own terms impacted your overall well-being and livelihood?
Yes, Senator, thank you for that question. I don't think we're very honest about what it's like to raise children, right? And that is a burden for many people. And speaking as I chose to have 2 children, parenthood is not easy. It's challenging. It's expensive. We have to make so many sacrifices for the well-being of the children, the next generation, that when people are forced to have children when they don't want to, not only are we impacting the mental health and well-being of the pregnant person, but it's going to ripple out into the dynamic of the family. It's going to impact the children. The alternatives that are often proposed are really not solutions. Like giving birth is an entire experience that can be traumatizing, that can be violent, that can push people into depression. And so for me, it is very important that I only want the children that I want to have, right? And regardless of how many times a person can get pregnant in their lifetime, we should never be expected to carry out more children than we want to. And I'm really grateful that abortion care allows me to choose when it is the right time in my life to continue growing my family or to stop growing my family. My priority is always, can I take care of myself and my children, right? Like, and are we in a good place? And that should be enough, whether, external forces should not be deciding for people what they can have. And as we're hearing, marginalized communities who struggle economically, this is a big strain and pressure, and it really impacts people's emotional and physical well-being.
Thank you for that. You spoke in your testimony here, but also in your written testimony about the work of the Abortion Fund of Arizona, about your work as the executive director of the Abortion Fund of Arizona, the number of patients that you have been at your fund has been able to support and to help. Can you talk a little bit about, from your experience and the people with whom you have had the opportunity to interact, how has the sort of confusing nature of the laws here in Arizona impacted those people who are coming to the fund to seek, resources, support, guidance, advice? Literally the sort of the rules of the road, if you will, have shifted quite rapidly on people here in Arizona. Can you talk a little bit about what that experience was like with the patients that were coming to the fund and what that's been like for you and your team?
Yes, thank you, Senator, for asking. To this day, people are still confused about, is abortion illegal? Is it legal in Arizona? So not only are we fielding calls for financial support, but we're actually having to explain the law, like, as it changes. And when we had the revival of the 1864 ban back in 2022, our state was constantly flipping between access and banning it. And it was like every day a person would call and say, can I get my abortion today or tomorrow? And it really was a matter of like, we don't know if it's going to change. Get your abortion as soon as you can, because the minute you find out you're pregnant, it is a ticking clock. It's a race against the clock to be able to access care, to find the finances for it, to be able to travel to wherever you need to go, find childcare, take time off work, all the things. And so people are still confused, and we're very grateful that at least our state leadership has taken proactive measures to really clear up the confusion and to do their best to make it publicly known that we repeal the 1864 ban. We have a 15-week limit that's still in place, but it is hard to reach everybody, and especially in rural communities where they lack good internet infrastructure. They are not receiving information in real time the way as people do in metropolitan cities. And so we still field calls every day explaining what the law is at this moment.
And Ms. Timaraju, from a national landscape, centering ourselves here in the people and communities, physicians in Arizona, to sort of pull us out and look across the country, the 21 states that have enacted restrictions or all-out bans. I know that Reproductive Freedom for All does an incredible amount of research, understanding sentiments of patients and people, residents across the country. Can you share with us, if you can, any sort of top-line research about where the people are in the 21 states that have seen these bans? What are the sentiments of those on the ground there? And if you have done the research to help us to understand the same kind of flip-flopping, it's not a very senatorial term, but that is the experience that people have been going through, the sort of flip-flopping that patients have been enduring since the passage of, since the decision in Dobbs.
Yeah, so first thing is there's no place in the country where abortion bans are popular, full stop. So even the states with the bans and restrictions, research and public polling shows the abortion bans are deeply unpopular. That's why when we say, it's been on the ballot 7 times, that includes places like Kentucky, Kansas, Virginia, where, Governor Glenn Youngkin tried to push a 15-week ban and say, Well, that's a compromise. It's not a ban. But voters repudiated him because they're like, we actually understand that 15 weeks is a restriction and it is essentially a ban. So the American public, 8 out of 10 Americans, want to see a federal right established, because right now what's happening is we're living in essentially a segregated society where I have different rights and freedoms depending on what state. So if I'm in California, I have most of my rights and freedoms, although there's still work to be done in California. But if we're in my home state of Texas, I have way fewer than you do in Arizona. In fact, it's basically a total ban. So what we know about public sentiment is that if we have the chance to put these measures to the people, we generally can win in almost every scenario, but we don't have the ability to be on the ballot in every state due to various state and local limitations and rules about how one goes to the people to amend a constitution. But the good news is in Arizona we can, and we're seeing really positive numbers. To your second question about the flip-flopping, the non-senatorial term, look, I mean, our contention has always been that anti-abortion extremists have designed these types of bans and restrictions to essentially create chaos. It's by design to have folks not understand the state of the law, right? It's not an accident. And that sounds nefarious, but this is a pretty nefarious set of organizations and leaders. So the more uncertain constituents are about the law, the less likely they are to seek the care. So, and to the doctor's point, the more likely physicians will be driven out of the state. And we're seeing that really starkly in places like Idaho, where there's now entire OBGYN deserts. But even in my home state of Texas, where I've talked to oncologists who feel uncomfortable practicing medicine because they can't advise their cancer patients what to do in the case of a pregnancy, right? So the ramifications are well beyond what we thought. The flip-flopping creates a constant state of not only anxiety, but it doesn't allow folks to stabilize, right? It doesn't allow care to be established. The other thing I'll mention, and I want to thank you and your colleagues in the Senate, there's Freedom to Travel for Healthcare Act, there's various efforts to protect travel, shield laws that California's enacted to protect providers who are practicing in other states from getting prosecuted. These are all really important solutions, but without the federal right, we're just going to keep, the best solution is the federal right that would cover all 50 states, so we're not just chipping away at short-term solutions.
I appreciate your sort of raising the term, Ms. Timaraju, around segregation. We are, it sounds as if what we're seeing from these state-by-state laws truly is, healthcare access being determined by zip code or imaginary lines on a map. And to those who are trying to sort of navigate the complexity of all of these laws that change from one moment to the next, truly does create an unequal healthcare system in ways that I think that we had thought that as a nation we were moving away from. Dr. Pangasa, one of the things that where there's lots of conversation, particularly with the deployment of technology, is a patient privacy. And I'd love to just offer all of you the opportunity to really speak to this question of patient privacy. Is that a concern that patients come to you with? How do we, are there, Ms. Timaraju, laws that Congress should be considering relative to patient privacy? Are either of you sort of seeing people make different decisions based on, not about their health care, but just life decisions, sort of based on whether or not their privacy can be protected? And I would offer that to all of you. And Doctor, it'd be great if you could start.
Yeah, absolutely. I will definitely defer about the federal protections that can go into place, but I'll just say from an anecdotal standpoint, in addition to the anxiety and uncertainty about what the law is, ultimately for a lot of my patients, it just creates fear. It creates fear of showing up to the healthcare system because you don't know which provider there or nurse there or doctor there is going to put something into your medical record and how that could potentially criminalize you in the future. the reality is that there are communities of color and marginalized populations that have already been sort of over-surveilled and more likely to be criminalized by the healthcare system, been more likely to be criminalized, and they fear coming to the healthcare system and having their health be used against them. And so, and we don't have great solutions for that right now, besides trying to be an individual provider who tells my patients that they're safe in talking to me. The reality is that we do still often have to tell people, like, be careful about who you talk around, because people who have been criminalized in this country have often happened from their healthcare encounters. And so I'll defer to my colleagues here, but it is certainly an issue that is of utmost importance.
Ms. Lopez?
Yes, thank you for sharing that, Doctor. I agree with that completely. And I think a lot about digital security, right? With technology, from a patient standpoint, a user who would be using apps and sharing with my healthcare provider what my history is, we see a lot of these period tracking apps out there now. We see apps to help with fertility awareness, but something that I love to go by is, if you have not paid for this app, you are being sold. You are the price, right? So your data is being tracked and distributed. And we have seen a state in the South, and I believe this might have been Mississippi, where the state subpoenaed Planned Parenthood and was able to look at the menstrual health records of people to determine if people were accessing abortion care. And, that's part of like just the routine screening when you go to a healthcare provider, disclosing when was my last menstrual cycle and all that. And now I do believe we live in a heightened state of caution when we're wanting to disclose honestly about our healthcare. And again, just, being mindful of, like, we're seeing cases where people get criminalized when they're talking about abortion and accessing medication abortion through social media chats. There have been a number of people who have been criminalized that way for, revealing that they accessed pills through some of the organizations that mail out pills to all the 50 states. But anything that you put out there digitally can, thinking with the mindset, it could get traced back to you and it could lead to criminalization.
And before I come to you, Ms. Tamaraju, on that question, just Dr. Pangasa, what are the medical impacts of a patient choosing to withhold that information from their physician? They are intent on trying to maintain their privacy and not be criminalized. But then on the other side of that, I assume that there are medical impacts and consequences that come along with that. Can you talk a little bit about that?
I think first and foremost, as I said, I became a physician, and so many people sit in the roles that I do because we want to be a safe place to educate our patients, to talk to them about what's going on in their lives, to figure out how to best help them. And when patients are fearful to be able to present that information, it can have absolutely resounding effects on their health. Within the world of healthcare, for those of us who are really trying to do the best for our patients, in certain settings, the sort of teaching has been don't ask, don't tell, because if you don't ask those questions, you don't have to put it in the chart, you don't have to report, which is devastating as a person who wants to be able to, I want patients to come to me and to tell me what's going on in their life so I can provide them with what are their safe, evidence-based options and to provide them healthcare in a non-judgmental way. And I think that when patients don't know that they have that safety, and when doctors are afraid to ask because they're afraid that they might create a negative situation for their patients, who do people go to when they actually have troubles, and when those things are withheld from their healthcare encounters? I mean, there are so many things that can go wrong, whether it's with regular health around pregnancy or about fertility or about menstrual health. The effects are really unimaginable.
Ms. Tamaraju, on the privacy question and any other topic that's been raised here, I know that there's a lot of work that Reproductive Freedom for All has done across these areas, and so I'd love for you to help us all understand and unpack the learnings that you all have gathered.
Well, I'm going to address first your question about what you and your colleagues can do. So there's a couple of things. To the points that were made about tech, you're already, as a body, very aggressively interrogating the nation's leading tech companies. You need to continue to do that. A lot of the privacy data issues you're already exploring as senators definitely impact this, right? There's a lot of data integrity issues that overlap and really create a lot of conditions of fear. And, to the point made earlier about if you're not paying the fee or the product, that goes for all of this reproductive health care data too. So your colleague, Senator Hirono, has the My Body, My Data Act, which is would create a national standard to protect reproductive health care data. So that's an important piece of legislation for folks to rally around. Also today, a new HHS rule by the Biden administration went into effect. It proposes to strengthen privacy protections by prohibiting the use or disclosure of public health information by a regulated entity for criminal, civil, administrative investigation, which is important. We just talked about how that's being weaponized by certain states, and the identification of any person for the purpose of initiating an investigation or a proceeding. So that was just, that just went into effect today. It was announced in April. And then I want to tell you about a bad bill, a bad bill we want you to help kill, which is the bill by your colleagues, Senator Britt and Senator Cruz, which frankly would weaponize collecting data. The registry that they're proposing, which I think they trust but verify, believed it would be a benefit for maternal health, but advocates on our side immediately saw it as an opportunity to weaponize data in a very, very problematic way.
Got it.
That's a lot. I can say more.
No, look, I want to encourage more. The intention for me in holding this hearing and developing the congressional record around this issue is to get the voices of people who are living this every single day into the record in perpetuity. As these cases continue to matriculate through our courts, as the legislation continues to move through legislative bodies, creating a fact-based record for reference is I think an incredible opportunity for us, and to bring, frankly, government closer to the people who are impacted by it. And so I appreciate all of you for participating and for joining. And so you can say all the things is the invitation. The last question that I would just offer for the full panel as we bring the hearing to a close is, what do you say, what should we all be saying to future generations who every day expect that they can go to their OBGYN for the first time when they are starting their menstrual cycle and get all of the information, or young leaders who find themselves in situations that were unexpected, whether it's domestic violence or unexpected pregnancy or medical challenges during their pregnancy, or young advocates who feel as if bodily autonomy is the first stepping stone to a true democracy. What would you offer them? What advice would you offer our young leaders in this moment as they think about where we are now 2 years post-Dobbs? Ms. Lopez, I'm happy to start with you.
Yes, thank you for such a question. I would say that, everybody has a story that connects them to reproductive justice, whether you can have children or not, right? Whether it's even if you identify as male and, your family, your neighbors, your friends who can have children, who are of reproductive bearing age. I would say share your story, right? Like it requires cultural change to change the narrative. There's a flag. To change the narrative of this work and to really normalize abortion, to normalize access to reproductive health care, to normalize talking about our bodies, to normalize menstruation and sexuality, right? All of this is so stigmatized and it creates shame. And growing up in a family that was extremely religiously conservative, no one talked to me about my period. Like I had to find that out on my own. And that's very disheartening that is, we are so afraid to talk and ask questions to our providers about our bodies and how they function. And so I would say look at your experiences and reflect back on what your life journey has been like and connect that to reproductive justice. And it's not just about becoming pregnant and terminating. It's also the communities we live in that impact how we can raise families. And if you choose to not have a family, it's the community that's impacting you. It's the community impacting your neighbors. Can we access food, right? Do we have stable housing for people? What is the economy like? All of this impacts our reproductive well-being. And so, this work extends so much broadly than simply abortion, than simply having kids or not. And it's really about how all the policies intersect with the well-being of our communities.
Thank you, Doctor.
I think about this personally in the fact that Arizona is my home, and I trained in other places, and was actually a very difficult decision to come back here because of the restrictive environments. And so, as I came back here, I had to remind myself, which is what I tell many other people, that even in places where you have to navigate barriers, even in places where you have to work around the rules and keep fighting, the impact on individual people, the impact on your individual communities is still very much felt. I remind myself of that regularly. And I like to remind other people that even in these environments in which it feels like things can be really taxing and really difficult to navigate, there are still so many people here fighting to make sure that every single person has access to safe health care, that they're able to show up to the doctor and not feel judged for their healthcare decisions and for their lives. And so, even in these times, post-Dobbs and post all of the litany of other things that have happened, just as a reminder that individuals still make impact, and together we can make an even bigger one.
I really love that. And I would piggyback that the other big issues that Congress can tackle are paid leave and the care economy and the fact that we're facing a childcare cliff. So there were several mentions of how challenging it is to be a parent, and we're in this forced birth situation, and yet we're not providing adequate care for the children that we have. It's really a moral imperative. So for us, reproductive freedom is not just abortion access, but also protection against, we didn't even get into contraception, IVF, how to have a family, how to use reproductive technologies, but also how do we care for the people who are here, right? How do we care for the pregnant people? How do we invest in maternal mortality efforts to curb maternal mortality? So that's something I think we all want to advocate for. I'll also mention we're doing research, as you've noted, right now on 18 to 35-year-olds, many here. This is a huge motivating issue for them to be civically minded, civically engaged come November. So I think it's really important that we're not just talking about this issue for electoral reasons, but we're understanding that if you're in that 18 to 35 demographic, you are entering your reproductive life without this fundamental freedom. So it's a galvanizing issue for that generation, but it's also our intention to hand this work off to that generation, right? They should be leading this fight. They are leading this fight. Some of the most critical victories we've had electorally, like the Ohio ballot initiative, were due to unprecedented surges in younger voters' participation. So I want to end on an optimistic note. And I'll finally say, along those lines, we have an opportunity to turn something really horrific and tragic into something really, really powerful. We can codify and create a federal right to abortion again very quickly. Our opponents took 50 plus years to overturn Roe. We can fix it. But we can also, and we have an opportunity to go well beyond that by really expanding and creating pathways for access and really dreaming big about what reproductive freedom looks like in this country. So That's my challenge to us, but also to partner with you in Congress to do so.
Thank you for that, and I accept the challenge. I believe that it is imperative that we provide true choice for life. And I know that it is a term that has been used in other contexts, but to truly be able to thrive, one has to be able to have a wage that can support their families. And so the work that is being done in Arizona to raise, and across the country, to raise the minimum wage. In order to be able to truly live free, you have to be able to have a place to live. And so the work that needs to be done on housing affordability and access, and mental health supports and substance abuse supports, all of it intersects at this question of freedom, and reproductive freedom is a part of that. And so I want to thank you all for helping to inform and all of us and truly interrogate this notion of states being the place where this freedom should be defined. What we have learned from our witnesses, and I believe from the lived experiences of women across the country who have lived under now the Dobbs decision for the past 2 years, is a patchwork is inadequate. A patchwork is un-American, and a patchwork is not freedom. And so I appreciate all of you for the work that you are doing here in Arizona and across the country to help us to restore the promise of America, not only to pregnant people and women who are living under these laws today, but to turn over to the next generation an environment where they are not less free, but more free. So thank you all for participating for today. The hearing record will remain open for 1 week for statements to be submitted into the record. Questions for the record may be submitted by other senators by 5 p.m. Eastern Standard Time on Tuesday, July 2nd. So witnesses, there may be other questions that would come to you from my colleagues. They have until July 2nd to submit those. And with that information, thank you all so much. The hearing will stand adjourned.